Hello and welcome to Doctor Story. Today's special guest is a renowned name in orthopedics. He's working as the senior orthopedic surgeon and sports injury specialist at Max Healthcare BLK and Max Panchsheel Park. Educated from prestigious Maulana Azad Medical College and pursued fellowship from Royal College of Surgeons of England. NHS in orthoscopy, sports injuries and joint replacement, Dr. Vinay Agarwal, MS and DNB Ortho. We will have the opportunity to discuss about our current lifestyle, fitness and exercise, and then move on to gym and sports injuries and the advanced surgeries that are done today to treat such injuries. A warm welcome, Doctor. Welcome to Doctor Story. Let me get started by stating that today's lifestyle diseases are one of the main problems we face. So there are long hours at work. We eat junk. Eating junk has actually led to many new lifestyle diseases. So according to you, to what extent can exercise help us in this context?
So, Anchal, we have a concept of today of exercise medicine. So, exercise medicine actually means exercise is medicine. So, it's not just simple going to park and just stretching out. It's every exercise has a meaning now. So, in my practice, what I follow and believe is that there are two kinds of prescription when a patient comes to me. One is a normal medical prescription that we advise for medicines and surgery or whatever. And another aspect, an equally important or even more important aspect of my prescription is exercise prescription or an exercise medicine prescription. So, majority of problems of musculoskeletal issues, back pain, joint pain, knee pain, shoulder pain, by and large, they can be managed by simple lifestyle modifications, especially for young professionals, middle-aged professionals who are doing long sitting hours in computers and also people who are doing work from home. In COVID time, we have seen there's a lot of work from home has been happening, and this has all kind of taken a toll on our health. Especially the musculoskeletal issues have been popping up. So our focus is mainly to educate and avoid and let the people know what mistakes they are doing. Follow good ergonomics, and exercise is also very specific. It's just like every drug has an action. So there is a specific exercise for every issue. For example, someone coming to me for back pain will have a specific set of exercise prescription, which we call it a gamut of exercise medicine, which includes strength and conditioning and all sorts of modalities which can be used. But it's an overall analysis of the patient and then prescription.
Oh, well, as you said that there is, very specific exercises that you recommend. So many people have suffered injuries during exercise or just random workouts that they just enter into the gym and start. So what can be done to prevent these injuries, and what are all the things we should be careful about?
So, the majority injuries in sports either happen when you are in a professional sports. People who are doing professional level sports like Olympic athletes and people who are following sports professionally. There, the reason injuries that the sports is high demand, like wrestling, judo. All these sports are very high demand and very injury prone. So that is one aspect of injury which happens in sports. The other aspect of injury which happen in normal people, civilians and normal non-athletic persons who go to gym for fitness, or weekend warriors, if we call this term weekend warriors, who sometimes we feel like that we want to just be fit, and one fine weekend we decide that we just want to do all the exercises. So this is a second category of people who we see in our, especially city life, where a lot of gyms have come up, a lot of fitness centers have come up, and we just want to want to make use of them, but we don't know how the right technique is. So the majority people, so athletic injuries I would not discuss here because that is part of their sports and that is very sports specific and that is handled, and when athletes come to us, they are handled in a different way. But overall, when we talk about a general population who get gym injuries, the majority people who do the mistakes are that they don't spend enough time on warm up. They just start lifting, or sometimes they start, they more focus on building the, weightlifting and weight training is more take precedence over normal cardio warm up. So enough warm up is not done. Sometimes their techniques are faulty. Sometimes they overdo things, or they, when we exercise, there is lactic acid accumulation in the body, and we have to understand that we can't go beyond a certain level of activity because lactic acid, even if we're trying our best and we have a strong willpower, but that lactic acid doesn't allow us to, exercise well, and that is the time when we get injured. So proper warm up, proper technique, very proper target what you want to achieve, whether you want to achieve weight loss, whether you want to achieve body toning, whether you want to achieve body strengthening, you want a good so that is, targets have to be decided, and that is what our role comes in, to guide people exactly what they want to achieve and what can be achieved at a certain level and certain age.
Well, thank you so much for that advice. Now that as we are aware of the possible injuries that you said, let's talk about the surgeries that would be necessary. If we could, let's just start with sports surgeries that you just mentioned. If it's to the shoulder, what are some advantages, to performing a minimally invasive surgery over a more conventional method?
So most of the sports injuries we are doing nowadays, operating on most of the people, we are doing by minimally invasive techniques, because we have a good quality arthroscopes, high definition cameras, we have robotic surgeries, we have precision guided ultrasound or C-arm guided technology, where we very precisely localize our area of interest. So majority of surgeries are minimally invasive. There is a very limited role of open surgeries nowadays. And discussing about the injuries, so shoulder, if we talk about shoulder, there are certain injuries like rotator cuff injuries. Sometimes the shoulder cuff gets separated, that's called Bankart injuries. So these injuries are very common in athletes, and also people who have, athletes or sports persons who have involved in sports which involve a lot of throwing, like javelin throw, shot put throw, and sometimes wrestlers also get this injury. Sometimes judo players get this injury they get attacking. So combat sports, and sometimes even gym people, while lifting and or sometimes even play fighting, people can get these injuries. So we address them, we investigate them. If they require surgery, we operate on them through arthroscopy, and usually the outcome is quite good.
We also received some inquiries related to knee surgery, like about the ACL. So do all ACL tears require surgery, and when it is required, what type of surgery is it that's done to repair the ACL also?
So that's a very good question. Actually, ACL is one of the most common athletic injuries, sports injuries, and very, very common in sports persons as well as non-sports persons. It's a very commonly injured ligament. Female athletes are particularly more prone to ACL injuries because females have a wider pelvis and a wider knee box, so they get more prone to injury of ACL. So, coming to your question of ACL repair, you see, ACL repair has a very limited and a small role, but it does have a role. If patients come to us in a very early case, sometimes people don't realize they have ACL injury. They sometimes start doing their own hot fermentation and self-medicating, and then they don't get well, and then they come back to us after many months. Sometimes people come to us after even years, even 5, 6, 10 years later they come back. So ACL injury is often missed sometimes. If patient comes to us early, at a very early stage, that is like within a few days or weeks, yes, ACL repair can be attempted. There are studies which have come up which suggest that ACL repair has good outcomes, but usually we have to do ACL reconstruction. So ACL reconstruction means that ACL is not repairable, and we take a ligament from the patient's own body, usually it's a hamstring tendon, and we fashion it into a form of ligament and fix it inside the knee with under arthroscopic guidance. It's a very established and very settled procedure. It's recovery to sports and recovery to active life is very comprehensive. But yes, there is a period of rehab where the patient has to follow our advice after surgery. There are certain no's and do's and don'ts which they have to follow for a few months, and then they get back to active sports and have a good lifestyle. So this is about the ACLs. Another injury which happens in the knee is medial collateral ligament, or MCL, and LCL injury. They are collateral ligaments. So again, every injury treatment depends on the timing and the patient's age group also. If patient is in active sports, then obviously the injury, the surgery is very essential, is must. Sometimes patients come to us in the higher age group, like 45, 40, 50% sedentary workers. In those cases, we might not even offer them the surgery. So it depends on the patient's lifestyle, their age, their body habitus. All the factors take into role when we decide what to operate, when to operate, and when not to operate.
Well, thank you so much. I think we have cleared that doubt of all the people who asked. Okay, coming to arthritis now, do athletes have an increased risk of getting arthritis? And if so, what types of surgeries do you perform to increase mobility or, elevate the pain caused by arthritis?
So regarding your first question, yes, do especially athletes who have been in demanding sports like like long distance runners, sprinters, or people who have a very who have been engaged in some kind of very strong physical activities like trekkers, mountain climbers, and also people who have been lifting weights a lot. Like weightlifters, wrestlers. Yes, they do have an increased risk of arthritis. When they, boxers also have increased risk of arthritis, especially when they use punching. Because arthritis is not just knee arthritis; it can happen any joint. Arthritis means inflammation of the joints. It's a wear and tear of the joint. So when any joint is overused, overuse can be because of overweight, can be because of overuse in terms of overuse of that, particularly more usage of that joint, like boxing. You are overusing your wrist joint a lot. So these people do tend to have arthritis, but it's not an incurable. I would say it's not like one condition where you don't have a treatment for it. There are various grades of arthritis, various types of arthritis. So whenever patient comes to us, we first of all assess their sporting background. We assess their how whether it's injury which has caused the arthritis or whether it is because of wear and tear and aging process and long time overuse of particular joint. And then treatment revolves starts from simple medications to good amount of strength and conditioning, and then getting onto the invasive procedures. Sometimes even small injections can be given to which are kind of anti-aging thing which prolong the life of the joint, like which is called a platelet-rich plasma. And also in terms of surgeries, when patient does need surgery, there are now again newer technologies have come in. We have the most modern replacement prosthesis, whether it's knee replacement, whether it's shoulder replacement, even ankle replacement is now picking up. So these are the prostheses and these are the types of gadgets we have, and all surgeries. But it's not like that. Every person is it's not like one shoe fits for all. So every person is customized. Every person may not need surgery, may need surgery, depends on me. And again, like for example, knee replacement. So we have come off the time when there was only total knee replacement. Now we have half knee replacement. We also have techniques called as high tibia osteotomy, where we kind of shift the weight of the joint to other side, and that increases lifespan of the joint without even replacing the joint. So arthritis has has kind of a lot of a gamut of solutions which are offered based on the customization.
Okay, and Doctor, can you just lastly enlighten us about orthobiologics? Like what kind of injuries they are used to treat and how they help to speed up the healing process?
So orthobiologics is a novel branch. So the world is moving towards nature again. We have seen that there are all replacements and everything, whatever we do. But at the end of the day, again, we whatever we can preserve is always better. So orthobiology is aimed at preserving your cartilage, preserving especially people in their 40s who are on the younger side, who cannot, who should not be going for replacements, as because they have on the younger side of age group, but still they have arthritis. So we do techniques which aim at conserving the cartilage. So this is called one of the techniques is autologous chondrocyte implantation (ACI), where we harvest the patient's cartilage, especially younger persons who have developed arthritis. We go culture them in the lab and then we reimplant the cells into their cartilage defect. Other technology, as I have already mentioned, is a platelet-rich plasma, which again takes the blood from the patient. High quality centrifuge machine is used to spin out that blood and to take out that the rich plasma, which is kind of elixir, kind of elixir, which kind of regrows the things back into position. So there is a upcoming and a promising role of these technologies of orthobiologics. It is free of side effects. It is one thing which basically conserves your cartilage, conserves your natural joint, conserves your natural thing, and also acts as anti-aging thing. So there are still studies going on, and we on our part we offer it to the patient whenever there is a patient who needs it and who is a likely candidate for it, and also when the outcomes are promising, and we hope that this branch will go quite further in the right direction.
Well, that's so astonishing. Indeed, it's been such an enriching discussion addressing such a topic. Thank you so much for joining, and truly appreciate the time we took off today for all of us.
Thank you.